All right, I'll just...
It's good now.
Today is October 14th, Friday. Well, it is a Bariatric Friday. We are back after 2 weeks. Dr. Isaias Irgau is with me. Dr. Erkan, how are you doing?
I'm doing great, Kemal. How are you today?
I am doing excellent. So these, sessions that we have back to back, so it's always fun. So we have our 3 patients who are going through the process. Denise, Patrick, and Karen. So they are still getting their clearances done. We are helping them with different things that they need in the process. So today we are going to discuss the support group aspect of the bariatric surgery process. Well, support group, we hear it from many different practices or many different specialties. Like we have one for diabetes, one for like our bariatric patients, but there are other mental support groups as well. Now, this is important for several different reasons, so we are going to discuss those with Dr. Irgau. So if we actually, Dr. Irgau, we can directly go into the topic, and then later on I will bring our qualification and other stuff out. So why do we need a support group? So Karen, Denise, and Patrick, so they are already given a lot of support from our care coordinators. They have several appointments. What would be the support group do for them?
Absolutely. So although bariatric surgery is by far the most effective treatment we have for long-term success with weight loss, Kemal, it's also possible for patients to struggle with weight regain in the long term, particularly after the 3rd to the 5th year after bariatric surgery. Patients can typically start struggling with some weight regain. Of course, there is a range for this. For some patients, it's a rebound of a few pounds to a level that is still acceptable to them and to us. For other patients, it could be even more significant, okay? And having support group engagement actually can mitigate that, can help patients really fight off those situations much more successfully. Clearly, bariatric surgery for weight loss, from our point of view, is not a destination, it's a journey, right? We want them to be successful in the very long term. That is really what distinguishes bariatric surgery from other forms of diets and other things that people could try from time to time, right? We want the surgery to be a long-term solution for them, which means that we want to be engaged with them in the long term as well. We want the patients to stay engaged, and one of the ways to stay engaged is really to participate in support groups. There have actually been studies that come out that have shown that patients who regularly attend support groups tend to lose more weight and keep that weight off for the long term. In fact, people have even looked at the frequency with which people participate in support groups, and the more frequent one participates, the more weight loss they will show in the long term. So support groups are a very important component of our program, and we highly encourage, obviously, our patients to participate.
So I think one of the big part of this is because the big change that they are going through, right, Dr. So I'm going to actually try to do something with you, and then I do this with our nurses time to time. So we really, when we are presenting these, I don't know if public or the friends of our patients, they have a really good understanding of what this is. And I'm going to be, I know you always get nervous when I try to new stuff.
It's okay.
I won't know that. So I'm going to share my screen for a second. So let's do this exercise. Now, before we go to this, so our Patrick, our patient, people may remember him or may not remember him. So here's Patrick. So Patrick BMI is 50. So my BMI is about 27, 28. So what I want to do is So I want people to kind of see, am I sharing the screen? I am. You can see the
Yeah, yeah, I can see your screen, absolutely. Yeah.
So, I'm, I think, 73 inches.
Mhm.
Well, actually, 6 feet and 1.
Okay.
Without my boots. If I had the boots, I'm 6'3".
Okay.
So the weight is, let's go with 212.
Mhm.
That gives us a BMI 28.
Yeah.
Now, people can see me, like I may be maybe 10 to 15 pounds more than what I should be right now.
Mhm.
But let's try to get to BMI 50.
Yep.
So
You have to add
37.
way more weight. Yeah. Yeah, that's a good guess. Excellent.
Well, I swear to you, I didn't practice this.
That's excellent. I was going to say double that, but you did a pretty good job, Kemal. You've been doing this job for too long now.
So 380 pounds. So
Yeah.
now I think from the support group standpoint, the person that we are talking about is, right now I don't feel my best. Like I wish that I can lose 50 more pounds. So this jacket would be it would fit a little bit better, but that's very like a minor problem if it becomes like the health related issues that we have. So now what we are talking about, the reason the support group would be important for someone like Patrick is because in the 8 to 12 month period, he may go down from 380 pounds to 230 pounds. So that's 150 pounds. It's one person that they're going to lose, almost like a average person. And that's a huge change physically and mentally, and everything is changing. So this is why I guess a support group is important from that point. Would you agree or disagree?
Absolutely. No, I do. In fact, that's actually a very important aspect of support group. The one I mentioned, obviously, is the obvious reason, which is to keep patients engaged so that their weight loss sits in the long term. But there are other very important topics that are discussed in support groups, right? So how to deal with the changes, for instance, right? The body image changes, right? Relationship issues, right? Struggles with stresses. All these are issues that we don't want patients to fight by themselves, right? In their own privacy. They need support for that, right? Because many of the questions that may come up, many of the struggles that they may encounter will be far more difficult for them to find answers on the go, particularly nowadays where there is so much access to social media and internet information. You want to get the right information, right, from reputable people. So if you come to support groups that are led by professionals and ours are led by either our surgeons or our nutritionists, then you are going to get factual information, right, that will help in your circumstances. So the issues that you've raised, how do you deal with the changes, right? The body image changes, for instance, which could be profound for some people, particularly. How do you deal with relationship issues that arise as a result of the changes that have occurred in you, right? Because these are struggles that are going to be common to many people, right? And these are good settings for you not only to be able to discuss, but you also have a safe place for you to discuss these things, right? Because you have people who have gone through similar experiences to yours, essentially. So support groups from this point of view are actually very, very important because not only you are going to find encouragement and also renew your commitment in the long term, but you are going to find literally support, right, in issues that you might be struggling with. So very, very important.
Absolutely. So now the way that we approach the support group is in two ways. Up to now, actually, we have our Facebook support group. It was not the event itself. It's just a group of people who can actually share their experience, their ideas, their questions, and then we do monitor those. But we actually, we have been running monthly support group sessions. Recently, we separated that on our website, and I do want to again share my screen to make sure that our patients can see that very easily. So anyone who can actually, who's able to go to the, as long as you have internet. So you go to CHRIAS.com. It's right on the top. So it's as you can see here, in a little bit. So one says bariatric support group meeting, and they're going to reword that actually, but right now that's how it is there. And the other one is Facebook support group. So if you go to the Facebook support group, and if you want to actually just participate in this, you have to have a Facebook account, and it will take you to right on CHRIAS page. So that you can actually join, and you can ask questions, you can share your experience. So that's one. The update that we made, because not everyone wants to be on Facebook, and we understand that, but we have our meetings, support meetings, first Tuesday of every month. Dr. Gail Wynn, most of the time is the one presenting, but our other providers are also participating. So when you just go to bariatric support group meeting, that's going to take you to this registration screen right here. And when you register for this event, the next one is coming up on November 1, 2022, and it's at 5 p.m. and you register your name, and then you'll be notified. So this doesn't have anything to do with Facebook. This is just one real-time meeting, so you can actually participate and ask questions or just listen to what we have to say and others have to say. So then we kind of updated that. Hopefully it would be useful for our patients who are going through the process. Now, Dr. Gal, with your patients who are coming in and out with the visits, do they ask you like how they can actually reach out to us? Like how do they actually, what's their experience in terms of participating in those events?
So patients are very happy when I inform them that we have support groups. You know, this is early when they are first preparing for bariatric surgery, but afterwards I remind them that we have support groups. And the reason I obviously remind them is because I feel it's very, very important. Now, in the past, as you know, patients were going through our Facebook page to be able to register for that. I think the fact that you now have a specific bariatric support group registration page, Kemal, I think it's going to be a lot simpler for patients to be able to participate. And as you say, the participation is, can be just listening, or it can be by asking questions, or it can be something that evolves over time. Now we have these support group meetings, obviously, once a month. In some programs, they have them once every 2 months or so, but once a month is actually a good frequency for us, I believe. Now, if patients can attend at least, 6 times a year, 7 times a year, I think that would be wonderful, right? Because it will be the right frequency for them to stay engaged, right? What we do not want is for patients to really forget about their basic commitments to lifestyle changes after the initial enthusiasm that inevitably happens as they are losing weight, right? We want them to keep that enthusiasm in the long term. And the only way to do that is to participate and to stay engaged in support groups are a wonderful way of doing that, obviously. What is also very important and what I'm preparing patients for, Kemal, is for the long term as well, 3 years, 4 years, 5 years, 10 years after surgery. When surgery, the memory of surgery is so remote, we want them to rekindle that commitment, right? Particularly when stresses occurs. There is a divorce, there is a loss of a job, there is a loss of a loved one. You're under tremendous stress. So you could be going to snacking, you could be going to poor quality foods that suddenly can reignite your metabolism in a very, very negative way. And without you, realizing it, you could be several pounds up, right? And then you enter into a situation of frustration because you try to get out of it and you can't. You lose your motivation and you enter in a very dangerous, vicious cycle, Kemal, where you could be rapidly going back to where you were essentially. And that is absolutely something that we don't want patients.
When the honeymoon is over.
It's over. Absolutely. Absolutely. When honeymoon is over, and then particularly when life events test us, right? When if we've known really a very secure way for us to deal with stress, which is eating, right, very often, or finding something that gives us instant gratification and takes us away from the stress for that second, for the moment, and we reach out for the food. And if we do that day after day, instead of really dealing it in the proper way, then we can be in trouble. Now, if we go to support groups, we are able to obviously talk about this. We can safely, right? Because they are patients like us. They are people who have gone through the same experiences, right? And we can raise those questions without any problem. Obviously, support groups are not meant to be individualized, right? These are going to be topics that concern most people, right? The best place for a patient to talk about their own individual health is still going to be to talk to their surgeon, to talk to their nutritionist, right? That's the best setting. But in support groups, there will be enough commonality of issues that can be discussed, right? One could be weight regain. What could be, hey, are there medications that can be utilized to help somebody that is struggling with weight regain? And what would be the options, right? Or it could be excess skin. How do you deal with that? Can we talk about plastic surgery? What is the role of plastic surgery afterwards? Or I'm struggling with my protein intake. Can we talk about protein intake in one of those sessions? How about exercise? All these important topics. And for some people, it might be another very important issue, which could be pregnancy after weight loss surgery. What are the things that I need to look out for? What are the things that I need to prepare for? And this could be a topic for the discussion as well. Or it could be even much more general things like, hey, where do we go shopping after bariatric surgery? Or our food, okay? What are the kind of recipes that we are using for us to have variety, right? And it could be a nutritionist presenting one day. It could be a psychologist presenting another day, talking about the issues that you raised, like body image and relationships. Or it could be the surgeon presenting issues that are pertinent to bariatric surgery in general, essentially. So what are we doing with the support groups? We are keeping people engaged. If people are engaged, they stay in the zone, so to speak, Kemal, right? Which means they are going to be able to successfully stay, with their weight loss in the long term.
So I think the way that we see how we actually kind of cope with change, if we know that other people are going through the similar issues, similar struggles.
Absolutely. Right? Absolutely.
So I think that's probably also is important for people to feel like this is not replacing your follow-ups with your surgeon after the surgery, as you mentioned earlier. We have our nutritionists who are available, and then they're still providing the service that's needed. But this is almost like kind of like completing the whole picture, so that not everyone is going to need it based on what we know. Let's actually just be kind of let's be real. Many of our patients are struggling with depression. So when it's not treated, or when people who are going through depression, when they have changes, positive or negative, the way that they are handling that can be different. So that's why the support group would be a really good way to actually, it would be a good outlet for those who may want to interact with those who went through the similar procedure and similar process, right? So I think although all the changes are going to be very pleasing and good, but there are these changes, handling these changes is where this struggle starts. And we want to make sure also, like with the support group, people can learn and understand the behavioral skills of what they need to do or what they need to improve, and it's free.
Absolutely. Absolutely.
So if we're able to bring the surgeon out on a Tuesday night at 5 p.m. for an hour, and we're not charging for it, it's free. And if it's the right thing for the patients, we believe it is, then we should take advantage of that. Now, of course, these names are not real names, but Karen, Denise, and Patrick, not sure if they are going through the process with the support, but we start the support group process now even earlier, right,
Yes,
Dr. So with our patient communication, one of the changes that we made are direct outreach through emails. So, and we have specific emails for these. And I just updated actually with this new support group versus support meeting. So they will be receiving those from day one. So one of the questions that we get a lot is it something that I need after the surgery? Well, the answer is no, because more than 50% of the patients who start the process are not going through the process, which is a lot less for us because we have a very strong discipline of care coordination team. But this is something that patients can start from day one and then continue with the with this after the surgery as well. What else did we not cover, Dr. Irgau?
I think we've covered it, Kemal. I think what the essence of this program, like we have talked in the past, is that bariatric surgery is a part of what we do, right? Because our overall goal is to get people to become healthy, essentially, right? And we also explain the fact that bariatric surgery, however powerful it is in inducing weight loss, it remains a tool, right? A tool. Right? And any tool is as good as how you use it, essentially. And what we want to do with support group is to give them additional resources to utilize this tool well in the long term, not to feel alone when they are struggling, 3, 4, 5 years later after bariatric surgery, right? We don't want to be a kind of faded memory. Oh, my surgeon was Dr. Irgau, he did my surgery at this time. No, I want to be present in their life afterwards by following up with them. We tell our patients, for instance, they are patients for life with us, right? We have a follow-up frequency that is fairly high at the beginning. We see our patients 2 weeks after surgery, then we see them at 1 month, then we see them at 3 months, 6 months, 9 months, 12 months, and then at 18 months, and then at 2 years, and then yearly after that, right, where we do blood work and all other things, right? But in addition to that, we have these support group meetings, which are fairly informal, but one has to be registered for it, and where we will be talking of a variety of issues, well, that we think are very, very relevant to all our patients. And as I mentioned before, studies have shown this actually increases the success of patients. The participation increases. In fact, our society, the American Society of Metabolic and Bariatric Surgery, highly encourages programs to have support groups, essentially, and that's why good programs like ours have this option as well for our patients, and we want them to utilize them as well.
So, Dr. It's a little bit interesting here. If you think about it, even this event is part of the support group. Right. So when we start doing this, we wanted to provide more education because if you think about the topics that we discuss in the support group, like the hydration, the vitamins, supplements, smoking, alcohol, the holiday time, which is coming up, which now this will be the 3rd year that we are going to have going through the holiday season with these challenges. So we are maybe 60-70% of the topics that maybe discussed in the bariatric group. We are the bariatric support group. We are bringing that up here. But I think there's the part where patients, when they know that others are going through the same, and then also one thing that we need to mention, this is happening in a private setting, so it's not open for public.
Absolutely.
So this is for our patients who are in American Surgery Center and St. Francis hospitals. And then they need to be a CHRIAS patient before or after It doesn't matter, but they need to be, we verify that. So it's in a private setting, so then patients feel more comfortable.
Absolutely. It's a safe place for them. Absolutely.
That's something that is important for people to understand. But also, like in some cases, I know that they do share the recipes of different foods and, related to cooking. There are several questions, the exercise, the access skin. So these are all, maybe someone else tried something and we would verify if it's safe or not. So then you don't actually have to go out of your way to find those.
Absolutely.
And I think it's definitely important for our patients to take advantage of this, and we encourage them to do that.
Sure.
So the overall the program, because we are repeating several of our topics on almost every other week or weekly basis, so we'll probably cover the qualification of how to qualify for, which is still a term. Who should qualify for the surgery. If they have this chronic illness, they should be going through the process without qualifying, but let's call it just lack of term qualification. So we'll cover that maybe at the next session.
Sure.
We'll be back next week, next Friday, and we'll have more updates from our 3 patients, and hopefully they're doing okay. Now, daily case conferences, I know it's helping.
Yeah.
Dr. That's so interesting. Like we had a patient, not one of these 3, but another patient who wasn't able to do the EGD for 9 times.
Oh no.
So he's scheduled 9 times, and he did everything else okay. When it comes to EGD, the problem is, sometimes we forget that people do have their work, their job, their life outside of what we are trying to help them, right? So, and getting time off, doing it at the right time, psychologically being ready. So I finally actually just reached out to this patient directly from the case conference, and I said, look, we really need to kind of finalize this. Either this is going to be the 10th time, and if you don't want to do it, it's fine. There's no pressure. So we just want to make sure that we do our part. And this is why the daily case conferences is great. So he actually did his EGD last Tuesday.
Wonderful.
Guess what happened? So he has H. pylori.
Oh no.
And that's why we are trying to do these things in a time, because now he's going to need medication, and it may take more than a couple of weeks. So we are getting closer to his surgery. So, but I think it's really safe, and the service that we are providing is unheard of. There's no.
Oh yeah, it's excellent. Absolutely.
Programming in the United States is providing what we are providing today.
Yeah, it's exceptional. It's exceptional.
That is important, and I want to make sure that we can have more people joining and again taking advantage of the bariatric surgery. Last week, I don't know if you were out of country, but if you were able to follow my session with Lieutenant Governor Bethany Longhole, we discussed morbid obesity partially in the session. One of the issues, today morbid obesity went apparently in the year 2000 when I started in healthcare. Delaware was number 34. The lower number is worse, so when on the top. So 20 years later, we are number 7 in the obesity rate, like adult and all together. It's not just one age specific. So we went from 34 to 7. Wow. So 7 being bad, and this is an issue that's affecting everyone. And bariatric surgery is utilized only at 1% of those people who can actually have the surgery. Absolutely. Only 1% is getting this. So that's why it is really important for us to keep doing what we are doing and educate public and reach out to more people, hopefully. Dr. Irgau, thank you so much for joining me today.
Thank you, Kemal. It's great session. Thank you.
Bye-bye.
Yeah, bye-bye. Bye.